Chapter 7 Surgical Instruments Netra Sikitsopayogi Sastra Jannam Susrita Sanhita has described 101 blunt instruments as yantras, Sutrasthana, 7th chapter, and 20 sharp instruments as sastras, Sutrasthana, 8th chapter. Yantras are described in 6 groups. Swastika Yantra 24, Nadi Yantra 20. Sandamsa Yantra 0 to Salakya Yantra 28. Tala Yantra 0 to UPA Yantra 25. Specific shastras are used for each shastra karma. Tatra Mandaladra Karpatre Syata Chedne Lekhne Cha, Vridhipatra Nakshastra Mudrikotpal Patrakardh Dharani Chedne Bhedne Cha, Suchi Kush Patrati Muksharari Mukhantar Mukh Trikurchkani Visravne. कुठारिका व्रीहिमुखारा वेतस पत्रकने व्यधने सूची च बडिशन दंतशंकुश्चाहरणे एषण्येषणे अनुलोमे च सूचः सीवने इत्यष्ट विधे कर्मण्युपयोगः शस्त्राणा व्याख्यातः सुसु 8/4 For Sedana and Lekhna, Mandalgara and Kharapatra. For Sedana and Bhedana, Vridhi Patra, Nakha Sastra, Mudrika, Utpala Patra and Ardhadhara. For Visravana Susi, Kushpatra, Timuka, Sarrimuka and Trikurchaka. For Vyadhana Kutharika, Vrihimukha, Ra, Vetsapatra and Susi. For Ahrana, Badisa and Dantshanku. For Anuromana, Isani. For Sivana, Susi. Surgical treatment is advised for 40 eye diseases. Sedana 11 Bhedana 0.5. Lekhna 0.9 Vyadhana 15. Important instruments used in modern eye surgery are as follows. Detailed description of the instruments. Cataract quiff, worn on grafes. Description: the blade is straight, narrow, and thin with a sharp point and one cutting edge.
Uses: for making corneal section ab interno, during cataract extraction. Figure 1 von Graf's cataract knife. Keratome. Description: the blade is flat, angled or straight, triangular with sharp pointed and both cutting edges. Uses: for making EB externo-corneoscleral section, which is later enlarged with corneal scissors. Figure 2 angled keratome. Capsulotomy knife. Description: fine tapering end of the needle knife is sharp on both edges. Uses: 1. Making incision in anterior capsule of lens during extracapsular cataract extraction. 2. Capsulo-iridectomy for after cataract. 3. Needling operation for congenital cataract. Figure 3 capsulotomy knife. Ziegler's iridotomy knife. Description: there is a fine hook-shaped knife at the end of fine needle. Uses: to make incision in iris in cases of updrawn pupil and after cataract. Figure 4 Ziegler knife. Fixation forceps. Description: this has 3x2 angular teeth with lock. Introduction. Figure 5 Fixation forceps. Description: has a wide jaw which is curved with 3 sets of 1 to 2 teeth. Figure 6 Fixation forceps. Description: there are multiple teeth without spring lock. Figure 7 Fixation forceps Colts-Bodib. Uses: it helps to fix the eyeball and also maintains support to the eyeball. 1. Cataract. 2. Glaucoma. 3. Iridectomy. Figure 8 Fixation forceps. Figure 9 Fixation forceps with lock. Superior rectus forceps. Description: the tip is S-shaped with 1 to 2 tooth. Uses: to hold the superior rectus to pass stay sutures to rotate the eyeball downward in. 1. Cataract operation. 2. Glaucoma operation. Figure 10 Superior rectus forceps. Plane forceps. Description: plane forceps with pointed edges. Uses: used to hold tissues in blunt dissection. Figure 11 Plane forceps. Description: this is a plane pointed forceps with horizontal secretions. Uses: used to hold conjunctiva in various operation. Figure 12 Moorfield conjunctival forceps. Corneal forceps. Description: these are tiny forceps with fine limbs. The teeth, 1 by 2, are directed downwards. Uses: for holding the cornea while passing corneoscleral sutures. Figure 13 Corneal forceps. Figure 14 Corneal forceps. Figure 15 Corneal forceps. Iris forceps. Description: small forceps with fine limbs. There are 1 by 2 teeth on the inner side of the limbs so that when limbs are closed the teeth cannot be felt. Uses: for holding iris tissue while doing iridectomy during 1. Cataract surgery, 2. Glaucoma surgery, 3. Iridectomy. Figure 16 Iris forceps. Figure 17 Iris forceps. Figure 18 Iris forceps. Capsule holding forceps, for intracapsular cataract extraction. Description: the tip of the forceps has a cup on back side. There are various type of curves in the thin limb of the forceps. Uses: for holding lens capsule during intracapsular lens extraction. Figure 19 Capsule holding forceps. Figure 20 Capsule holding forceps. Capsule holding forceps, for extracapsular cataract extraction. Body. Description: this is a tooth forceps, 3 by 4, the jaws are placed at an angle to the. Uses: to catch the anterior capsule and rupture it for extracapsular cataract extraction. Figure 21 Extracapsular extraction forceps. Fine needle holder. Description: has a delicate spring handle with finely serrated jaws with or without a lock. Uses: for holding fine needles during eye surgery. Figure 22 Fine needle holder. Figure 23 Needle holder with lock. Figure 24 Needle holder with lock. Large needle holder. Description: has a flat grip, with a lock. Uses: used to hold bigger needles, for example in 1. Entropion operation, 2. Terraraphy etc. Corneal scissors. Description: they are fine curved scissors, the blades are kept apart by spring action. Uses: used to enlarge corneal and corneoscleral sections. Figure 25 Corneal scissors. De Weeker's scissors. Description: these are fine scissors with small blades at the end at right angles to the handle. The blades are kept apart by spring action. Uses: for cutting the iris while doing iridectomy. Figure 26 De Weeker's scissors. Plain scissors, straight, curved. Description: fine pointed plain scissors. The blade may be straight and curved. Uses: to cut the suture threads, conjunctiva. Figure 27, plain scissors, straight and curved. Aerosophake. Description: one end has a rubber bulb and the other end is of metal which is hollow. The edge is shaped like a cup. Uses: was used earlier to remove cataract, intracapsular. Figure 28 Aerosophake. Lens expressor muscle hook. Description: there are curved round ends with blunt knobs. Uses: 1. To break the zonule and help in the delivery of lens during intracapsular lens extraction. 2. Expression of the nucleus of lens during extracapsular lens extraction. 3. During squint and detachment surgery to hook the muscles. Figure 29 Lens expressor muscle hook. Iris repositor. Description: this is flat, malleole blade with blunt edges and tip. Uses: to reposit the iris after iridectomy. Figure 30 Iris repositor. Lens spatula. Description: this has a flat club-shaped ends, made of steel. Uses: used to give counter-pressure in delivery of the lens by tumbling method. Figure 31 Lens spatula. Wire vectis. Description: this is a wire loop. Uses: to take out a dislocated or subluxated lens. Figure 32 Wire vectis. Heat cautery. Description: has a round metal ball with a blunt tapering edge. Uses: the bulb retains heat for a long period. Used to cauterize bleeding vessels on the sclera. Figure 33 heat cautery. Figure 34 heat cautery. Cannula. Description: has long curved or angled tube. The edge is blunt. Uses: used for 1. Injecting air in anterior chamber, 2. For syringing of lacrimal sac. Figure 35 cannula. Towel clip. Description: has a lock and 2 curved pointed ends. Uses: for holding linen used in draping of patients. Figure 36 towel clip. Lid retractor set. Description: bulldog clip and lid clamp. Uses: the lid clamp is screwed onto the lid and pulled and clamped to the linen with the help of bulldog clamp, used to retract lids during intraocular operations. Figure 37 bulldog clip, lid retractor set. Undine. Description: this is a water container with a long narrow tube, made of glass. Uses: for irrigation of the 1. Conjunctival sac, 2. Anterior chamber. Figure 38 Undine. Cyclodialysis spatula otter. Description: it is a narrow, flat, blunt-edged spatula with blunt tip. The spatula is concave downwards and is attached at right angle to the handle. Uses: for separating the ciliary body from scleral spur in cyclolysis operation. Figure 39 cyclolysis spatula. Scleral punch. Description: the cutting edges are a solid sharp thick blade which presses into a hollow rectangular frame, thus cutting a rectangular piece of sclera. Uses: for removing a piece of sclera or corneosclera during glaucoma operation. Figure 40 scleral punch. Took's knife. Description: the flat blade is broad at the end and tapering on both sides like a chisel. Uses: 1. To separate the corneoscleral lamellae while doing trephine operation. 2. To separate scleral lamellae during trabeculectomy and retinal reattachment. Figure 41 Took's knife. Trephine. Description: it is made up of a handle which takes up different sized blades. The blades have circular cutting edge at the tip. Uses: for making circular holes in the sclero-corneal junction during trephining operation for glaucoma. Figure 42 Trephine. Paracentesis needle. Description: arrow-shaped needle with sharp edges. Uses: to make corneal incision while doing paracentesis. Figure 43 Paracentesis needle. Nettleship punctum dilator. Description: this is a round rod with fine tapering and pointed edges. Uses: to dilate the punctum before doing syringing or probing of lacrimal sac. Figure 44 Nettleship punctum dilator. Lacrimal probes, Bowman's. Description: these are a set of straight thin wires of varied thickness. The ends are bulbous. Figure 45, Lacrimal probes, Bowman. Coors lacrimal probes. Description: these are a set of thin wires of different thickness. The probes are curved with blunt ends which are slightly bulbous. Uses: for probing of nasolacrimal duct in 1. Congenital dacryocystitis, 2. Chronic dacryocystitis. Figure 46 Lacrimal probes. Pigtail canalicular probe. Description: this has a curved probe at either end with suture eyes just back of the blunt end. Uses: used in reconstruction of torn canalicular ducts. Figure 47 Pigtail canalicular probe, lacrimal syringe and cannula. Description: this is an all-metal syringe with single thumb ring and 2 finger bands about the barrel. There are 2 cannula curved straight. Uses: for doing syringing of lacrimal sac to thin the site of obstruction. Figure 48 Lacrimal syringe and cannula curved straight. Tweedy's canalicular knife. Description: the small, thin narrow blade is blunt and round at the tip. Uses: to make a slit opening into the canaliculus. The blunt tip is inserted into the punctum and then the canaliculus is slit open. Figure 49 Tweedy's canalicular knife. Lacrimal retractor. Description: this is a self-retaining retractor. The retracting surface is made up of 3 to 4, curved pins. Uses: retract skin and mus in 1. DCT, 2. DCR, 3, or any other surgery on the sac. Figure 50 self-retaining lacrimal sac retractor. Figure 51, self-retaining lacrimal sac retractor. Cat's paw retractor. Description: has 3 fork-like project-ins. Curved downwards. Section. Uses: to retract skin and muscle in 1. DCT, 2. DCR, 3, or any other surgery on the sac. Figure 52 cat's paw retractor. Bone punch. Description: has a spring mechanism. The lower blade has a cup-like depression with horizontal serrations. The upper blade has a hole with sharp edges. Uses: used for cutting lacrimal and nasal bone in DCR operation. Figure 53 bone punch delicate size, medium size, large size. Hammer. Description: a stainless steel hammer. Uses: while cutting the nasal crest with the help of chisel during DCR operation. Figure 54 hammer. Chisel. Description: has a flat sharp tapering blade. Uses: used to cut bone during DCR operation. Figure 55, bone chisel. Lid retractor des Mars. Description: has a saddle-like retracting end. Uses: retracts the lids to provide wider palpebral aperture. 1. While examining the anterior segment. 2. Removal of cornoscleral stitches. 3. Double eversion of upper lid to see fornix. Figure 56 lid retractor des Mars. Eye speculum. Description: has 2 buck-type loops at end of long arms and there is spring action spread of arms, can be fixed at any place by a screw. Uses: it opens wide the palpebral aperture by retracting the lids during 1. Squint operation, 2. Pterygium, 3. Detachment. Figure 57, eye speculum. Figure 58 eye speculum. Lid spatula. Description: has 2 slightly convex surfaces at either end. Uses: used to support the lid while doing minor lid surgery e.g. tamsorrhaphy and entropion. Figure 59 lid spatula. Epilation forceps. Description: small forceps with thick sharp edges. Uses: to pull out cilia in cases of trichiasis. Figure 60 epilation, cilia, forceps. Chalasian clamp. Description: the clamp consists of round flat disc on one side opposed by a ring. This has a cross action. Uses: to fix the lid during Chalasian operation. It provides simultaneous hemostasis by pressure of ring on the plate. Figure 61 Chalasian clamp. Figure 62 Chalasian clamp. Chalasian clamp. Description: same as previous one but instead of cross-action, this has a screw-locking mechanism. Chalasian spoon. Description: there is a small cup with sharp edges at the end of a narrow handle. Uses: for scooping out the contents of Chalasian. Figure 63 Chalasian spoon. Entropion clamp. Description: consists of a D-shaped flat disc opposed by a U-shaped loop. It can be tightened on the lid. Uses: to hold the lid during entropion operation. It also provides simultaneous hemostasis. Figure 64 Entropion clamp. Trachoma rasp. Description: there is a broad end with rough file-like serrations. Uses: was used to file the trachoma follicles. Figure 65 Trachoma rasp. Tenotomy scissors. Description: this is ordinary scissor with angular blades and knobs at the lip. Uses: used for blunt dissection of 1. Conjunctiva, 2. Tenon's capsule, 3. Cutting of muscle during squint surgery. Figure 66 eye scissors tenotomy. Muscle clamp. Description: this has 4 single teeth fitting into opposite side. It also has a locking mechanism. Uses: used to hold muscle during squint surgery, especially muscle resection. Figure 67 Muscle clamp. Calipers. Description: this has TW limbs, a graduated scale is attached to one, the other limb can be moved by a screw. Uses: used for measuring distances in squint surgery and retinal detachment surgery. Figure 68 Caliper. Ptosis clamp. Description: has long curved serrated blades with locking mechanism. Uses: to hold the levator muscle, to prevent folding or bunching of muscle and helps in dissection of the muscle during ptosis surgery. Figure 69 Ptosis clamp. Enucleation scissors. Description: the cutting blades of the scissors are curved. Uses: for cutting the optic nerve in enucleation operation. Keeping the curved surface towards the eyeball. Figure 70 Enucleation scissors. Enucleation spoon. Description: spoon-shaped instrument with a cleavage in the center. Uses: used to fix and pull the optic nerve in enucleation operation. Figure 71 Enucleation spoon / evisceration spoon. Description: this is flat spoon-shaped but slightly squarish at the edge. Figure 72 Evisceration spoon. Figure 73 Evisceration spoon. Description: flat slightly hollow spoon. Uses: to scoop out the choroid and other intraocular contents in evisceration.